Welcome back to Cheddar's News Wrap, everybody. We were just talking to COVID-19 survivor Karen Bischoff about her experience as a coronavirus long hauler. Long haulers are people who have reported lingering symptoms of the virus for months, including chronic fatigue and lung damage. Studies suggest that there could be hundreds of thousands of so-called long haulers right here in the United States. Here to shed light on this phenomenon is friend of the show, Dr. Jen Caudle, family physician and associate professor at Rowan University. Dr. Jen, welcome back to the show. We just heard Karen's story. How concerned is the medical community about these long-lasting effects that some patients are still experiencing, in Karen's case, 6 months later?
Yeah, no, we are very concerned, and my heart goes out to Karen and anyone else who feels they are a long hauler. You know, Henny, you talked about it so appropriately. COVID long haulers, that's the term that we've given people who, even though they have sort of, gotten over the acute phase of COVID, they still have lingering symptoms that can last for weeks, that can last for months. Many of these folks have tested negative for COVID, but they still have symptoms. So yes, we are very, very concerned. And one of the things that I'll probably say many times during our interview tonight is that there's just a lot that we don't know about it, which is unfortunate.
We heard about Karen's symptoms, but doctor, what symptoms do coronavirus long haulers typically experience?
Yeah, so there are a number of symptoms, and I love the graphic that we have up here. Many people report, fatigue and sort of remaining cough and things like that. But also you can get heart palpitations, chest pain or chest discomfort. Some people get shortness of breath, nausea, headaches. Many people sort of describe a lack of what we call exercise tolerance, meaning they just don't have the energy that they used to have. You know, someone who may have been able to go to a fitness class 4 or 5 days a week and work a job and take care of the family, now does not feel like they have the energy, say, to do that. That's one example among the many different examples of symptoms that we have. So the symptoms can be wide-ranging, and sometimes people have just a few, sometimes people have many symptoms.
You know, it seems that there are two types of COVID-19 patients, those that have a mild response, recover pretty quickly, and others that have longer-lasting effects, 3 to 6 weeks to recover, like we heard Karen, months. Is there any understanding to why this is?
You know, that's a great question. And I should say that there have been a number of studies done on patients who have recovered from COVID but still have lingering symptoms, these long haulers. But in many cases, these folks have actually had mild COVID symptoms. So it's not definitive that, say, if you have more severe symptoms, you're at higher risk for these long hauler types of conditions afterwards. That's not necessarily the case. In fact, there are a couple of studies I just want to mention very briefly. The CDC, over a telephone survey, they evaluated almost 300 people. 35% of people had not returned to their usual state of health 2 to 3 afterwards. And, 1 in 5 of those people between the ages of 18 to 34 had no underlying chronic medical conditions. Underlying medical conditions is not even necessarily a criteria for this, nor is the severity of the illness that you have. The question about why is this happening is a big question. Is it due to sort of the immune system's response to the infection? Is it due to something else? There's a lot of questions we have, and we just don't have enough answers. So time will tell, and hopefully we will learn more about exactly why this is happening.
I'm curious, do most long haulers have underlying or chronic medical conditions before contracting COVID-19, typically?
Well, that's what one of the things I was just saying is not necessarily. In the CDC study that I just cited, in that 18 to 34 group, 1 in 5 of those people who had these long hauler symptoms had no underlying chronic medical conditions. So that's not necessarily, say, an indicator of whether you're going to have long hauler symptoms or not. Just like whether you have mild versus severe disease is not necessarily an indicator either, because we do see people with mild disease, COVID disease, that end up being long haulers. So right now, I don't know that we can say definitively who's going to get this and who is not.
Are there recovery and treatment options for these long haulers, Dr. John?
Well, we're learning a lot more about it, and certainly as physicians in the medical community, there's more articles and papers being written about it in scientific journals, and we're looking into this certainly more. Karen's story is certainly a remarkable one, and I'm so happy to see all the advocacy work that she's doing for others. One of the things she mentioned in her interview with you all is this desire to have more centers and places where long haulers can be treated, and from a scientific perspective, I'm interjecting, hopefully being evaluated as well. There's a number, actually. There's Mount Sinai actually has a center for people with symptoms of COVID after after they've recovered. So that's a good thing. Hopefully we will see more of these centers that pop up around the country. And, honestly, among physicians, I'm actually a part of a number of physicians COVID groups on Facebook. And we often talk about the symptoms that our patients still have after recovering from COVID. So not only are we learning about this, but we are also working as a sort of a medical group to try to provide the best resources, treatment, et cetera, making sure our patients are seeing cardiologists, pulmonologists, whatever specialists they may need to make sure they're getting the help that they deserve.
And Dr. Jen, before I let you go, what advice do you have for people experiencing this or going through long haulers, what the symptoms that long haulers are seeing?
Yeah, so I think some of the best things, first of all, obviously talk to your doctor. I mean, I know that sounds like it should be self-explanatory, but I think it's really important not to suffer in silence. If you're wondering if this is what's going on with your symptoms, that's a valid question. You should have the opportunity to discuss that with your doctor. Karen made some great suggestions that I really love. She said this idea of documenting your symptoms, not just the big symptoms, but the small ones too, and how often they come and go. That's actually really, really helpful for us doctors, is when you can sort of give us a log or kind of really go through what you're experiencing for how long and the timing of such. And I think those are two really good first steps. Again, the hope, Hannah, is as every single day in this new reality that we're all living in, we learn more and more about COVID. It seems like more things come to light. The hope is that we will not only get a vaccine and more treatments, but we will also figure out and learn how to treat those who are COVID long haulers as well.
We always appreciate your medical insight. Family physician, Dr. Jen Caudle.
Sure.
Thank you, Dr. Jen.